At one time or another, you have probably felt bloated. It's that too full feeling you get in the belly after you eat a bit too much. Or it might be the type of food you just ate, or how fast you consumed it. Certain medical conditions like celiac disease, irritable bowel syndrome, or ulcerative colitis might also make it more likely. Abdominal bloating is when the abdomen feels full and tight. It commonly occurs due to a buildup of gas somewhere in the gastrointestinal tract. Bloating causes the belly to look larger than usual, and it may also feel painful or tender. Bloating usually happens when excess gas builds up in the stomach or intestines. Please make sure to subscribe to my channel. It really helps me make more videos just like this. When bloating occurs right after a meal, it usually resolves itself, but it's often possible to speed up this process. Bloating can cause discomfort, but there are many ways to reduce it. Exercise, supplements, massage, dietary changes, and other strategies can help reduce bloating quickly. Bloating is very common, occurring in 16 to 31% of the general population. Fortunately, it's generally a short-term problem that resolves on its own, often triggered by a large meal or gas-producing food. However, for some people, bloating is a chronic problem that causes moderate to severe symptoms and negatively affects quality of their life. Gas is a natural byproduct of digestion, but too much intestinal gas means your digestion is gone awry. While you can ingest gases by swallowing air or drinking carbonated beverages, these gases mostly escape through belching before they reach your intestines. Gases in your intestines are mostly produced by gut bacteria digesting carbohydrates in a process called fermentation. If there is too much fermentation going on, it is because too many carbohydrates were not naturally absorbed earlier in the digestive process before reaching those gut bacteria. That could be for several reasons. Maybe you just ate too much, too fast for proper digestion. Or you might have a specific food intolerance or gastrointestinal disease. Digestive contents can build up in your digestive system when there is a backup or restriction in your digestive tract, or when muscles that move digestive contents along are somehow impaired. Any buildup of digestive contents along the digestive tract will leave less room for normal amounts of gas to process through. It also leaves less room for other things in your abdomen, including circulatory fluids and fat, making everything feel tighter. Causes of buildup can include constipation and bowel obstructions. Now, here are some quick tips to stop bloating quickly. Try going for a walk. Physical activity can get the bowels moving more regularly, which can help to release excess gas and stool. Getting the bowels to move is especially important if a person is feeling constipated. Although you might feel like taking a nap after a big meal, walk for 10 to 15 minutes instead. A walk around the block can provide fast relief from gas pressure. Peppermint oil capsules may also be helpful for indigestion and gas. This is also used as treatment for symptoms of irritable bowel syndrome, but people without IBS can also use them to relieve bloating. Peppermint oil works by relaxing the intestinal muscles, which allows gas and stool to move along more effectively. People should always follow the instructions on the packet, and anyone who is prone to heartburn may need to avoid peppermint oil. Antacids have been shown to relieve inflammation in the digestive tract and help pass gas more easily. Antacids often include the active ingredient simethicone, which works to pass gas by grouping smaller gas bubbles together. Simethicone pills and liquid are anti-gas medications that can help to move excess air out of the digestive tract. It is really important to speak with your physician if you have any questions. Herbal teas, including ginger, turmeric, fennel, chamomile, and peppermint, can aid digestion and help process gas. Dandelion tea can help relieve water retention. Also, massaging the abdomen can help to get the bowels moving. A massage that follows the path of the large intestine is especially helpful. People can follow the steps below to do this. Place your hands just above the right hip bone. Rub in a circular motion with light pressure up towards the right side of your rib cage, and then rub straight across the upper belly area towards the left rib cage. Then move slowly down towards the left hip bone. But quick fixes are not always effective for some causes of bloating. However, people who have frequent bloating may find that certain lifestyle changes can tackle the causes and reduce bloating over time. You can use these simple steps to try to prevent bloating in the long term. Try consuming more fiber, which helps to prevent constipation and bloating. Most people in America do not get adequate fiber, with only 5% of people meeting their recommended daily fiber intake of 25 grams for females and 38 grams for males. It is important to bear in mind that eating too much fiber or increasing fiber intake too quickly can cause even more gas and bloating. So when increasing your fiber intake, it is best to start slowly and increase the intake over several weeks. Fizzy, carbonated drinks also contain gas that can build up in the stomach. The carbon dioxide that makes soda and similar beverages fizzy can also cause bubbling and bloating in the stomach. Sugars or artificial sweeteners in the diet may also cause gas and bloating. But drinking water eliminates these issues and helps to treat constipation as well. You can also try chewing gum more often. The sugar alcohols in gum can cause bloating in some people. Many people experience bloating directly after a big meal. It is possible to avoid this by eating several smaller meals each day, which can help to keep the digestive system moving. Also know that swallowing food quickly can introduce air into the digestive tract. Drinking from a straw can also lead to people swallowing more air, which in turn leads to gas and bloating. People who have bloating should avoid using straws if possible, and try eating slowly to avoid swallowing air during their meals. Probiotics and prebiotics are good bacteria that live in the intestines. Taking a probiotic supplement may help to regulate the colon bacteria that can produce gas and cause bloating. Also, to reduce bloating, you may want to reduce your salt intake. An excess of sodium causes the body to retain water. This can cause a swollen and bloated feeling in the belly and other areas of the body, such as the hands and feet.